Today we are going to talk about spinal cord and reflexes. So spinal cord, which is part of the central nervous system that we are going to learn today in detail, like the gross anatomy and the cross section, and as well as the reflex. So let me get the PowerPoint slide first. Okay, so spinal cord, which is the part of the central nervous system. So we learned in earlier lesson that central nervous system comprised of two parts. One is spinal cord, one is called brain. Brain we are going to study later on. So spinal cord, basically what they're doing, they're taking the information upstairs, and they're getting upstairs means in this case brain, and they're getting the information out from there and go down. So this is basically, some book will represent as like a highway. So we have an upward and a downward highway, or we call them ascending tract that takes the message towards the up, and descending tract that takes the message down to the. So lots of neurons are here in this part of the central nervous system. So where it is located, it is basically begin at the foramen magnum. We learn in bone class that the occipital bone has a huge opening called foramen magnum. So the brain, when they form the brain stem, it's starting with the foramen magnum all the way through the vertebral column to the coccyx. Okay. Yes, the true cord will end before it reaches to the coccyx, but the whole thing right now we are going to look at from foramen magnum to the coccyx through the vertebral column. That's our spinal cord. So this is how they look like when you cut, when you take a cross section. So if you take a cross section of it, this is the cord. So if you look at the pointer, that's the cord. So that's the cord is traveling through that vertebral foramen, which putting together makes the column, and from foramen magnum all the way to the coccyx. Okay, but the cord ends around like L1, L2, like lumbar 1, lumbar 2 region. We are going to talk about that a little bit later. Let's first focus on the outside of the spinal cord. So the spinal cord, so this is the cord, which is a bunch of nerves together. They are surrounded by meninges. So meninges is a very strong material that protecting your central nervous system, brain and spinal cord both. So here we are going to learn part of the brain too, like brain and spinal cord both covered by meninges. And cerebrospinal fluid, the fluid which is commonly known as CSF, that is present in the spinal cord as well as in the brain. Okay, so if I'm going to talk about detail about this cross section a little bit later. So let me teach you a little bit, and then we'll come back here to learn all the terminology. But first, let's look at the meninges. So meninges are they have three layers. So meninges is the membrane. It's a tough membrane that covers the brain and the spinal cord both. And exactly same way, meaning dura mater outside, the middle one is called arachnoid mater, and the innermost layer is called pia mater. Okay, now pay attention to the word mater, mater. The mater came from a word called mother. So, you cannot be better protected, you cannot offer any better protection than a mother. That's why the name, and dura means strong. So that's why the first one called dura mater. The second one is arachnoid, meaning they have a little bit of spider kind of extension. Okay, that's why the name arachnoid. and pia means delicate. So delicate mother, it's all the way inside. This is represented by three different colors here. So the outside one is dura mater, the middle one is called arachnoid matter, and the inner one is called pia mater. Okay, so pia matter is the delicate one adhering the brain. So a lot of blood vessels. So there's a lot of blood vessels right there. And also from the pia mater, we have denticulate ligaments. Those are here. So they're attaching on the side. So they're stabilizing the spinal cord by attaching to the other matters. So they're stabilizing the spinal cord at the and on the side, and they have a function also at the bottom. I'm going to mention that later on. It's called phylum terminal, coming up later on. So one more time, the meninges is three layers. So the outermost layer is called dura mater, the middle layer called arachnoid mater, and the innermost layer called pia mater. Dura mater is an extremely strong material. They're all the way outside. Now, if you go back to our cross section right here, if you go back to our cross section right here, this is dura mater right here. And arachnoid is side by side, and the pia is all the way inside to the core. So between the vertebral bone and the dura mater, this space is called epidural space, right here, epidural space. Normally, if adipose or fat tissue, they're protecting that area, or they're insulating that area with the fat. So the gap between the vertebral bone and the dura mater, that's called epidural space. And the gap between, which is very little here, between the dura mater and arachnoid mater, so this is dura and this is arachnoid, the gap between them is called subdural space. Okay, so epidural space is right there. Sometimes, during the childbirth, they put anesthesia right there on the epidural space so that the nerve can calm down. And right over here, this space between the arachnoid and the pia, that's the subarachnoid space. So that is subarachnoid space right where the CSF is there. Okay, and the pia is all the way towards they're adhering to the spinal cord. So those are the meninges. You can look at here also. The dura mater is all the way outside. Arachnoid, obviously, a thin film right under the dura mater, and pia is all the way inside to the space. So this space is called subarachnoid space, and that space right there is called epidural space. That's for identification purpose, like when you're studying the anatomy. Now coming back here, so how the spinal cord looks like. So they're studying at foramen magnum, and as I said, they go all the way up to here. But the true cord, meaning when you're putting them together, it's like a cord-like structure. The true cord ends right here between L1 and L2. So in the end, they become like a cone shaped. So they're coming from the top and become like this. So they become like a cone shaped. Okay, that cone shaped area is called conus medullaris. So that cone shaped area is called conus medullaris. So if you look at here, so the true cord keep going, and then they extended maximum up to L1, L2 region right here. So that area we call conus medullaris. The bottom part where the spinal nerve keep exiting exactly at the appropriate level, and then they keep exiting to the body, that they appear like a horse tail. So horse's tail or ponytail, that's why this region, the collection of those spinal nerve at the bottom of the cord, we call them quaeda equina. Quaeda means tail, equus is a scientific name of horse. So quaeda equina are the bunch of the collections of the spinal cord at the bottom of the conus medullaris. Now, the dura mater and arachnoid mater and pia mater, these are the three layers of meninges. The dura is outermost, arachnoid is the middle, and pia mater is the innermost. Dura and arachnoid, these two, they are not going to continue all the way. They are going to end up around like S1, S2 region. Only the one that will going to continue adhering all those nerves are the pia mater. So that pia mater finally created a thread-like structure that actually anchor the spinal cord and stabilize them with the floor, like a coccyx bone. So they're actually going to anchor that towards that. That part, that thread-like extension right over here, we call it phylum terminal. So phylum terminal is nothing but a thread-like extension of the pia mater. So pia mater continue all the way. But again, dura and arachnoid, they are going to stop around like S1 and S2 region. Okay, so that's basically the overall anatomy, starting from foramen magnum to the coccyx. Now, a couple of important part right here. If you go back, I can use another. 1 second, let's go back to this. Right here, if you pay attention, right at this area, we call it like a cervical, like a neck region. The spinal cord is slightly extended, like slightly swelled, slightly bigger, okay? That area we call cervical enlargement. And same thing over here, we call that area lumbar enlargement. Because right here, more nerve gives rise to serve with the upper limb. So we go to the like hand. And same thing in this area, in the lumbar, the more nerve gives rise there to serve with the bottom part, like the your legs at that location. So that area, we have a little bit enlarged spinal cord. If we look at their circumference, those are known as cervical and lumbar enlargement respectively. Okay. Now, if we look at the cross section, so this is the cross section of the spinal cord, but we are going to learn this. I'm going to go down a few slides, so we're going to learn that from one particular slide, which looks exactly same as this, but they have some extra information. And then we're going to come back here and go over one more time. So I'm going to skip a few slides and I'm going to come right over here. Because this part we have discussed a little bit on my first neuron lecture. To remind you about that, so basically if we touch a hot surface, we move our hand. We talked about that. If we touch a hot surface, these receptors here, they're going to take that information about the heat. Then that's a receptor. So receptor is number one. They're getting the information. Then sensory neuron is going to bring that into your CNS, central nervous system. And then in the central nervous system, there are some control center. Those are all mostly interneuron. They are association neuron. They are deciding what to do based on the information they have received. And once they have received this particular incident, they have received that information, this is extremely hot, then they are going to send a motor neuron. They are going to send a signal through the motor neuron to the outside. And that neuron will come right here in this particular muscle group, and that is known as effector, which contract, and their contraction will result in movement of this hand. This is also the mechanism for reflex, and that is why it's known as commonly as a reflex arc. The reason I'm mentioning the reflex, because once you know the mechanism, it's very easy to understand the inside anatomy of the spinal cord. So reflex is a very quick, fast, and involuntary response. So it is going to happen. So for example, just for an example, if I put my hands to the eye will like blink. You know that's going to happen, but you cannot stop that thing happening. So you know commonly if we hit the patellar ligament with a clinical hammer, your knee will jerk. You know that your knee jerk, but you cannot stop that being happen. For example, if you put your finger through your mouth, you gag. You know it's going to happen, but you cannot stop that being happening because that's reflex. So it's a fast, involuntary response. Okay, and how it's happening? The mechanism is same. So in this particular example, they use stimulation coming from a nail prick. So somewhere in the skin, they get that pain. So the pain receptors is activated. Now this is the sensory neuron. Now what is important here, now you have to pay attention to this part. The sensory neuron, we learned prior that sensory neurons are all unipolar neurons. sensory neuron are all unipolar neuron. That means they have one single pole. And that particular area, which is cell body of the sensory neuron, they're in the outside of the CNS, because this is CNS, this is PNS. In the PNS, cell body is called ganglion. So that's the ganglion part right there, where the cell body is, okay? And then the sensory neuron go into the spinal cord from the posterior side. This is to remember. This side of the spinal cord is the posterior or the dorsal side. This side of the spinal cord is the anterior or the ventral side. 100% time, meaning in all the time, the sensory neuron goes into the spinal cord from the back door, from the dorsal side. So the sensory neuron will come in from the dorsal side, and the ventral side, the motor neuron will exit from the ventral side. So this is the motor neuron. So the information comes through the dorsal side. That's why this part sometimes known as dorsal root. And they bring the information, then interneuron or association neuron, they are thinking it over. What happened? There could be one, there could be the hundreds of interneuron involved, and sometimes there is no interneuron involved. And then the motor neuron comes out right here, which is sometimes also referred to as ventral root, and they will go to the muscle. In this case, the muscle will move. Okay, so again, if you break it down, number one is receptors. Number two, sensory neuron, which is bringing in from the posterior side. Number three, integration center, which is right here. They're deciding what to do. Number four, motor neuron, right here. Motor neuron is coming out from the ventral side. And finally, the effector, which is in this case muscle, is acting like the effector, where the motor neuron are trying to execute the job. So whether it is a nail prick or a hot surface you touch, you move your arm, that's exactly this explanation is. Now, what we learned here about the structure of the spinal cord or the cross section of the spinal cord is, this side is posterior, this side is dorsal, this side is anterior. Posterior or dorsal, anterior ventral. Now, sensory neuron always coming from the dorsal side, and motor neuron always go out from the ventral side. This is important. And let's go back to our original discussion of the okay. So this side again is the posterior side. This side is the anterior side. In the posterior side, there is a slight groove, not very detailed cut. There's a slight groove that is known as posterior median sulcus. Posterior median sulcus. On the anterior side, it goes all the way inside, creating like a long cut. That's why the name anterior, right here, anterior or ventral median fissure. So posterior median sulcus, this side will be calling anterior median fissure or ventral median fissure, posterior or dorsal median sulcus. And I said earlier that the sensory neuron always go from the posterior side. So they are getting inside from the posterior side. This is the axon of the sensory neuron, which is also known as dorsal or posterior root. So that is going in, dorsal of the posterior root, right here, dorsal of the posterior root. And this bulging area where all the ganglions are, we call dorsal root ganglion. The ganglion, we learned earlier, is cell body in the PNS. So when cell body in the PNS, we call that area ganglion. So this is dorsal root ganglion. So just by recognizing, that's the key for the lab also, because in the lab, you have to learn the spinal cord anatomy in detail. So just by recognizing those dorsal root, you know that's the dorsal side. So this bulging area, that's a dorsal root. That's dorsal root ganglion. And this is the dorsal root that goes into the posterior side. Now the gray matter appears to be like a letter H, like a butterfly shape, okay? These extended area are called horn. These extended area are called horn, H-O-R-N, horn. Obviously, posterior or dorsal horn, this side a little bit thicker, that's called anterior or ventral horn. And in some areas, particularly from like T2 to L1, that area of the spinal cord, we have a lateral horn as well. So lateral horn, or right here, lateral horn, this side is the ventral or anterior horn, and that is the posterior or the dorsal horn. Posterior or the dorsal horn is much narrower than the ventral side. The reason is very simple, because in the ventral side, we have more cell body. Because you may remember in CNS, which is this, the gray matter is nothing but the cell bodies. So cell body is representing the gray matter. So more cell body in this area. That's why this ventral side is much more wider compared to the posterior side. Obviously, the presence of this gray matter divide the white matter also into three groups. So this is the posterior group, this is the lateral part, and that's the ventral or the dorsal part. It is known as, these are like column. You look at the spinal cord like a column. So these white matter are called white column, where the bunch of tracts, myelinated tracts, are running together. Those are white columns. White columns, sometimes also known as funiculi. Funiculus is the singular, funicula is the plural. So this area right over here is the posterior white column. This portion is called lateral white column, right over here, lateral white column. And this portion is called anterior white column, or some book may refer to as posterior funiculus or funiculus, lateral funiculus, and anterior funiculus. Again, funiculus or the column, white column, is the same thing. Then these narrow connections on the both sides of the gray matter, that narrow connection with the spinal cord, like they're connected to the both sides, is known as gray commissure. Commissure means like a narrow bridge. So gray commissure is the area where they're joining to the left and right side. And the central canal is located right there on the gray matter. So central canal is the canal that is at the, it's not normally circular, like it is slightly oval shaped central canal. And number two is they're lined, the canal is lined with ependymal cells. The canal is lined with ependymal cells, and they're filled with cerebrospinal fluid, CSF. So the oval shaped canal, they are lined with ependymal cells, one of the neuroglial cells or the supporting cells in the CNS, and they are filled with cerebrospinal fluid. You can take that note because it is not written on this particular slide. So that gives us the entire structure here of the spinal cord. So for the lab purpose, we can use the same model or the model that I showed you before to explain all this word that we just said. So right here, that's the spinal cord. This side is the posterior side. This is the anterior side. So that is posterior group. That will be the sulcus. And right here, it could be ventral fissure. Okay. The horn divided into three areas: posterior horn, lateral horn, or ventral horn. The connection on the two sides, that dot is the central canal. The connection on the two sides, those are gray commissure. And this is a white column. So this is ventral column, or ventral white column. That is dorsal white column or posterior white column right here. And on the side, this is lateral white column. Okay. So, and then again, this is the epidural space, dura mater, arachnoid mater, subarachnoid space, and the pia mater. And this is where the dorsal root ganglia is. This is dorsal root ganglia, that's the dorsal root ganglia. That is the dorsal root that going in, that's a ventral root. So always remember, this is very important to understand, the dorsal root always go from the posterior side. They are always going in from the posterior side. And ventral root always come out from the ventral side. And ventral root carry motor neurons, and dorsal root carry sensory neurons. Okay? And then finally, these are the spinal nerve. So the question is, how many spinal nerves are there? There are 31 pairs of spinal nerve. There are 31 pairs of spinal nerve. So from here to here, there are like 31 pairs of spinal nerve. This is important to understand. Bone, if we remember the bone, we have 26 vertebral bone. So we have 7 cervical bones, C1, C2, C3, C4, C5, C6, C7. In this case, we have 8 cervical nerve. Very important. So we have 8 pairs of cervical nerves. We have 8 pairs of 7 bone, but we have 8 pairs of cervical nerve. So how we name them? The first nerve that come out on top of the C1. So this is the C1. The first nerve comes out on the top of the C1, the first pair, and we call them C1. Then the second one comes out on top of C2. We call them C2. Same thing, C3, C4, C5, C6, C7. And then the last one that comes out on top of T1. Remember, there are 7 bone, and then it starts with thoracic bone. So on top of T1 and superior of T1, that's C8. Then the naming changes. Then inferior of the T1, T1, inferior of the T2, T2. So we have T12. So we have 8 cervical spinal nerves, 8 pairs. And then we have 12 pairs of thoracic nerve, 12 pairs of thoracic nerve, same match with 12 pairs of 12 thoracic bones. Then we have 5 lumbar bones, L1, L2, L3, L4, and L5. So we have 5 pairs. Everybody is coming inferior to the bone. But remember, we had 1 sacral bone. But here we have S1, S2, S3, S4, and S5. We have 5 sacral nerve pairs. So 5 pairs of sacral nerve and 1 coccygeal nerve. So 8 plus 12 pairs. So 20, 25, 30, 31. So we have 31 pairs of spinal nerve. All spinal nerve are mixed nerve, meaning the whole nerve consists of some tract going in, sensory, and some tract coming out. So all of the 31 pairs of spinal nerves are mixed nerve, neither pure sensory nor purely motor. So let's so we talked about the gray matter, we talked about the white columns, and we already know the reflex, basically the automatic response in change of the environment, and we know the mechanism of reflex. The reflex mechanism is they have 5-point reflex arc. So point number 1, receptor, sensory neuron bringing the information, integration neuron or integration center decide what to do, motor neuron taking out the signal, and effector executing the final work. So this is reflex arc. So now we're going to talk about, before we go back to the spinal, last part of the spinal cord, I want to talk about a little bit of reflex. So basically what you need to study in this particular chapter, apart from examples are not so important. What I expect you to know is the classification reflex. So I made this particular slide, so please read right from here. So let's discuss this. So we know what reflex is. It's a fast, involuntary, quick response of the body as soon as there is a change in environment or the stimulation. So now, according to the development, meaning if we born with some reflex, we call them innate, or sometimes it's called primitive reflex. We're born with that. And some are acquired. Rest of your life you're learning. So the easiest example to understand or the innate reflex is sucking reflex. So the child, or the newborn, when they're born, as soon as they have something on their tongue and they touches the palate, they suck because that's their food. So as soon as they take it to near the mother, they will start doing the breastfeeding because they know that's their food. So that's one example of innate reflex. So there are many, many other examples as well. Okay. Acquired is like, the easiest example is like you're riding a bicycle. So you learn how to balance over those 2 wheels. That's acquired. You're riding a roller coaster. You are not roller coaster, roller blading. You are doing that. So those things are acquired. So you become a best goalkeeper in the hockey game. Think about that. Tiny puck is moving so fast that the goalkeeper can catch that easily. So those are called acquired reflexes. Okay. According to the response, that's very straightforward. Like who is doing the job, who is executing the function. Remember the motor neuron. So motor has two divisions, somatic and autonomic. Obviously, if the somatic nerve is involved, we call somatic reflex. And if the autonomic nerve, parasympathetic and sympathetic involved, we call autonomic reflex. I mentioned those words in the last lecture as well, in the nervous system lecture. So somatic reflex, basically what somatic nerve does, somatic nervous system, they only handle the skeletal muscle. So remember this way, whenever skeletal muscle is involved for a reflex action, whenever a skeletal muscle is involved for a reflex action, that's a somatic reflex. Whenever autonomic regions are involved, meaning nervous system involved, meaning cardiac muscle, smooth muscle, glands are involved, autonomic reflex. I'll give you an easy example. This is how you should think. Let's say knee jerk reflex. Knee jerk reflex, meaning if this is the knee, if you hit the knee and the knee will jerk like this. You can YouTube that, tons of videos out there to just explain that. Now, think this way, or even easier example, corneal reflex, like when you blink. So if somebody asks you, is corneal reflexes somatic or autonomic? How do you answer that? This is how you answer that. Just think, can you do it voluntarily? So can I blink? The answer is yes. That means that skeletal muscle. Remember, skeletal muscle is the voluntary muscle. Can I jerk my knee? The answer is yes. Yes, I can. I can jerk my knee. That means involvement of skeletal muscle, voluntary. As soon as that is the answer, then that must be somatic reflex. Gag reflex, somatic or autonomic? Think about it. So this is the answer. Can we gag normally? The answer is yes. So skeletal muscle is involved. Autonomic, for example, if you put a powerful light to your pupil will dilate. Autonomic, because that's how autonomic nervous system is doing, because you have no control. Like you cannot voluntarily dilate your pupil. Only when light goes, your body can do that. That's what the autonomic reflex is. Okay? You cannot increase your heartbeat. When you get scared, your heartbeat will instantaneously jump in. That's autonomic reflex. According to the complexity of the circuit, so synapse means the junction between neurons. So monosynaptic means when there is only one junction. Polysynaptic when there is multiple junctions. So if you go back to the reflex circuit again, like reflex arc right here, this is one synapse here, second synapse here. So two synapses. So this is polysynaptic. If this neuron does not exist, meaning body knows exactly what to be done, like for example, knee-jerk reflex, that's an example of monosynaptic reflex. That's an example of monosynaptic reflex, meaning one synapse is involved. Again, you don't need that many examples, but just to know what is polysynaptic and what is monosynaptic. And finally, according to the processing side, remember central nervous system has a brain and spinal cord. If the brain is the one that processing all the information, that's called cranial reflex. And if your spinal cord is doing the job, we call spinal reflex. Okay. And finally, some of the somatic reflex, meaning some of the reflex that involve in the skeletal muscle, commonly they are stretch reflex, like you're touching something, you stretch, or knee jerk, that's like a tendon reflex. Then flexure reflex. Then we have cross extension and superficial cord reflex. We don't need very detail of it. You just need to know these are somatic reflex involving skeletal muscle. Individual mechanism you do not need. You need an overall mechanism. I just put this to understand the knee-jerk reflex, how it works. This is an example of the tendon reflex, but you don't need that detail. You don't need that detail like mechanism. You just need to know 5-point reflex arc mechanism, 2 slides before that I mentioned. This is just for your information. And finally, one interesting thing, you should know that like one of the spinal reflex is like a plantar reflex. So if you take a little bit like not so sharp, this is like a backside of the clinical hammer. So if you take that kind of instrument, and if you go under your sole like this, all your toes should curl down. Like they go towards the stimulus. If this is the stimulus, they go towards the stimulus. So that's called plantar reflex. So it will happen like plantar flexion, basically. So plantar reflex. But if the great toe flare up like this, which can be seen in the early childhood, which is normal. Very early childhood is normal, but in the adult, there is some problem in the CNS. So that's one of the primitive, old, I would say, but very popular neurological analysis of the CNS. Like doctors often use this Babinski sign. If you go to YouTube, there's a video for Babinski sign, you will see that displayed out. Okay, coming back to the spinal nerve again, 31 pairs of spinal nerve. I already explained to you that C1 to C8, 8 spinal nerve, 12 pairs of thoracic nerve, T1 to T12, 5 pairs of lumbar nerve, L1 to L5, and 5 pairs of sacral nerve, S1 to S5, and 1 coccygeal nerve pair. These together, 31 pairs. All of them are mixed nerve. All of them are mixed nerve. Now, although these are 31 pairs, but sometimes, like, look at this area. Sometimes here, 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 they make a network. They make a network. We call that plexus. So the network of nerve that they create, they're interwoven. So those are known as plexus. There are 5, but 4 plexus, like a coccygeal plexus. Some book will mention that, but we don't need to know. We are just going to focus on the 4 major plexuses: cervical plexus, brachial plexus, lumbar plexus, and sacral plexus. So the first thing we need to know, C1 to C5, all these nerves together create cervical plexus. Right here, cervix means neck. Brachial, something to do with the arm, so they're going in serving the arm. They're C5 to T1, so C5, C6, C7, C8, and T1. Lumbar, mainly L1 to L4, some thread of T12 can be there, and sacral L4 to S4, okay? These are the plexus. Now, some inside those plexuses, some of the nerves are very important, and you should know it. So what I created a separate slide for that. By the way, I'm going to come back to this a little bit later because we know that already. Okay, so these are the spinal, 4 of them, 4 spinal reflexes. So cervical plexus, plexuses, cervical plexus, brachial plexus, lumbar, and sacral plexus. So if you go to the cervical plexus, the one major is the phrenic nerve. That's why I mentioned this kind of slide. So you must know this. So one major is the phrenic nerve. Why? Because that nerve controls your diaphragm muscle right here, which is helpful for breathing. So when you're breathing in and out, in the NP2, we are going to learn that breathing mechanism. So damage to that, you can't really breathe. So it's going to bring to the respiratory arrest. Brachial plexus, there's C5 to T1, all the nerve, mainly ulnar, radial, all these nerves. No significant one. That's why all these nerves are important for your hand, but nothing to memorize here. Lumbar, that serves in the bottom, like a lower part of the body. And one of the major important nerve is femoral nerve. Again, lumbar is from L1 to L4, they together combined. The lumbar nerve, so lumbar plexus, but femoral nerve is one of the major nerve that serve that area. And finally, sacral plexus, which is basically L4 to L5 and S1 to S5, S4. So together like L4 to S4. But there is one nerve, very important, and I'm sure you heard about that. That's all the pain-related thing in your lower limb. That's sciatic nerve in that area. So those plexus. So you are supposed to know 4 plexuses: cervical, brachial, and lumbar and sacral. And what nerves make them, and 3 important nerves I mentioned: phrenic, femoral, and sciatic. Those are the 3 you should know about, these plexuses. Before we go end, just coming back one slide right here, which is the structure of the nerve. The reason I'm talking about this last, because you already know it. In the muscle chapter, skeletal muscle tissue chapter, I explained to you the inner layer or individual muscle, they're wrapped with endoneurium. Then there's a bundle called fascicle called not endoneurium, endomysium muscle, and fascicle, that is perimysium, and then epimysium, same concept here. Same concept, only thing, mysium will be replaced by neurium. So when entire individual nerve is covered, we call endoneurium, lapping of individual nerve fiber. Then all of them making a bundle create a fascicle or nerve fascicle that is called perineurium. And then finally, when we have an outside layer, we call epineurium. All our spinal nerve follow this connective tissue covering exactly like muscle. So one more time, this particular slide, that is also, you are also responsible to know it for your lab purpose, because in the final lab practical, we can ask question from here. You can, I mention all of these during my lecture, so you can watch that video one more time. And as well as I'm going to put a YouTube video that I found very easily describable, a nice video. I'm going to put that in the lab section as well, so that take a look at that. Okay, so that is the entire spinal cord chapter. And in the next video, I'm going to describe, I'm going to do the brain. And then after the brain, in the last video, I'm going to come back to the neural physiology, because neural physiology requires a little bit of reading. So the last video we are going to do with the neural physiology.